Hi, I'm Bridget Everhart. I'm one of the diabetes educators at UCH Metro Campus, and this is a short video on how to use an insulin pen. So insulin, most all insulins come in an insulin pen version versus vial and syringe. And there are different kinds of insulin pens, but they all work about the same. So here's one kind of insulin pen, and all insulin pens are pre-filled with insulin, and then you attach a needle on the end, and you find the dose by dialing it up in this window. Okay, so that's one kind of pen. And then this is another kind of insulin pen. Looks very similar. The insulin is pre-filled. This is demo, that's why it says that. And then again, you find the amount by dialing it up in this window. Here's another different kind of insulin pen, same idea. The insulin is pre-filled. Now this one doesn't have much left. This is a demo pen, so you can see it just has a little. And then you dial up the dose in that window. So I'm going to show you on this insulin pen how you teach a patient. So also, insulin pens are really helpful for people who are visually impaired because each unit on most all pens, each click is one unit. So 1, 2, 3, 4, you can hear it and you can feel it. So if you're visually impaired, it really is helpful. So that is the basics of the different insulin pens. So I've took this off. Here's how you actually teach the patient to deliver this insulin. So the first thing you do is you have to attach an insulin pen needle. So this is the needle, and you have to take the paper off. So you hold it and you pull the paper all the way off, and there's a little needle inside there because that's going to puncture the rubber stopper on the end. So you take this needle and you screw it on, just like you'd screw on anything else. You screw it on, and then there's two caps. It's a little unusual, so you have to tell the patient that there's two caps. You take the first cap off and you take the second cap off. All right, and then this is your dose finding window. Again, so you can see 1, 2, 3, 4. Before you give the insulin injection, you have to do a test dose to be sure that all the insulin has gone through. There's no air pockets, the needle's on correctly, and it's going to work correctly. So you dial it up to 2, 1, 2, and then you push the plunger to make sure that some insulin comes out, because then you'll know it's going to work when you need it. So push the plunger. I dialed it up to 2, push the plunger, and then you can see the drops of insulin come out. You push it all the way back to 0, right? Now it's good. That was your tester dose. Now let's say that the patient needs 6 units. So we did the tester dose, we know the needle's on correctly, so you dial it up to 6, 1, 2, 3, 4, 5, 6, and you can see the little arrow there is right on the 6. Here's 5, here's 6, right? So they're going to get 6 units. Now, they can get a lot of units at one time with a pen. You know, if you dial it way, way up, and we don't want this confusing for patients because the dose here, this would be 60 in the dose window, so they don't pay attention to this. So like this would be 42. That would be the amount of units they're going to give each other, not this. Give themselves. So let's go back to 6. Here we are at 6 units. We're all ready to give it. So we're going to give, this is going to be like the patient's abdomen. And of course you clean first with alcohol like you always would. Clean, clean, clean. And then a good way to hold this is so that you can see the dose window when you deliver the dose. Because to deliver it, you push it all the way down. Thumb works best, it's strongest. And when it goes all the way back to 0, you know that it's delivered. So if you have the dose window facing you, then you can see for sure that you've delivered it. So let's imagine this is the abdomen. You've cleaned it off with alcohol, and then you go straight in. And with insulin, you can go in straight or at an angle. You really can either way with the syringe or this pen, just so it's in the subcutaneous tissue. So you've put the needle all the way in, and then you press to deliver the whole dose all the way down. And one thing that's different with the pen than a syringe is that you have to hold it. It's supposed to be for the count of 10 seconds, but I always tell people a slow count of 5. So they've pushed it in, then 1, 2, 3, 4, 5, and then you take it out. Just because the mechanism, it just takes a little bit more effort to be sure that all the insulin has gone in. So that is the delivery of the insulin. Then to take the needle off, we tell people at home it's easy to take the needle off just by putting this cap back on. Now they can recap because it's their own, it's their own needle. We wouldn't do that in the hospital, of course. So they always have to take the needle off each time and throw it away and then get a new needle each time. They can't use the same needle over again, just like same with syringes. So to take the needle off, just like I said, you could put that on and then just unscrew it. Then it's a little bit easier and safer. If someone's helping them, then they won't get poked either. And then you just recap it. And any insulin, like syringes also, it's good for 1 month out of the refrigerator. Another little piece about insulins is, remember, if it's an NPH insulin, then you do have to mix it, right? So with these pens, you can just roll it to be sure it really is mixed like you would with NPH anyway. So that's the insulin pen piece. And then for Colorado and many other places, these sharps, these needles, and also any lancets when you're sticking your finger for blood sugar testing, they go in the regular garbage, but we tell people to put them in something that's not going to poke the, the garbage person. So like a laundry detergent bottle with a top on or something. So it is a sharp. You can see that there's, a needle on the other end that had to puncture. So that is how to use an insulin pen. So if you needed to give some written materials for patients, there is a care note that's really pretty good, and it's called How to Use an Insulin Pen. So you can print that out and give to the patient also. Where you can put it on the AVS, put the care note onto the AVS. And on the Metro campus, we do actually have some little insulin pen demo kits on the 6th floor AIP1 and also on the 9th floor AIP2. So if the diabetes educators or someone's not here to help with our own demo materials, then you can get those to help show the patient. Thanks for watching this video on how to use an insulin pen. I hope it was helpful. If you have any questions on teaching patients about using insulin pens, contact the diabetes team members on your campus, or you can always call us at Metro. Thanks.